Good morning, all of you. Myself, Pujan Shah from final year BPT, is going to initiate the very well known disease and very mysterious disease known as Alzheimer disease, and for the day which we are going to celebrate today. So, first of all, I would like to give some basic idea about the Alzheimer's. Alzheimer's is known as a degenerative disorder of brain, in easy language we can say. The degeneration takes place in mainly three parts of the brain, and the functions which are affected are the functions of those three parts. So, first of all, I would like to show the contents. So, it contains our definition, anatomy, and functions of the brain areas concerned with the disease, causes of the disease, clinical features, diagnosis, and treatment. So I will take definition part, anatomy and causes parts, and clinical features and diagnosis and treatment part will be taken by Mansi and Prachi of our classes. So I would like to start with definition. So what is Alzheimer disease? So Alzheimer's disease is a degenerative disease of the brain occurring in the middle to late life, but an early form of the disease is now well recognized. So Alzheimer disease is effective to mainly middle and late life. Middle is something what like uh, greater than 40 to 45 years of life, and late life is around like 60 to 70 years. We can take it roughly as that fact. So this is the it is mainly a degenerative disease of the brain. You can clearly see in the images the left side of the portion is shown of the normal brain, and the right side of the portion is shown of degenerative or the Alzheimer's brain. You can clearly see the difference between the brain, that how degeneration is taking place. The disease affects more than 4 million people in United States, resulting in over 10 1 million deaths per year. So the disease is quite this is the normal demographic data. The risk of the disease rises sharply with advancing the years. So if any person is affected with the Alzheimer's disease, then we can say that when the age increases of the patient, the disease rises and the symptoms rises very sharply. Now anatomy part. So mainly three structures of brain are affected. First is hippocampus, second is temporal lobe, and third is frontal lobe. So first of all, with the anatomy part of hippocampus. So hippocampus is a curved elevation of a gray matter that extends throughout the entire length of the floor of the inferior horn of the lateral ventricle. So I will show the image. See, this is the circle which I am doing. That part is the hippocampus. The cloud like part over here is the hippocampus of the brain. It forms the base of the inferior horn of the lateral ventricle of the brain. The cortical structure of the parahippocampus is gyrus is six layered. So there are six layers of this gray mat of this part. As the cortex is traced into the hippocampus, there is gradual transition of a six to a three layered arrangement. So basically there are six layers, but when we do the transmission, it becomes the three layer arrangement. The three layers are the three superficial layers are molecular layer, pyramidal layer, and polymorphic layers. So these are the three main layers of hippocampus which I am showing right now. I guess you all can see in the recording. So hippocampus is also seen. Now, temporal lobe. The primary auditory area is or Broadman areas 41 and 42 are also known as temporal lobe. It includes the gyrus of Hischel's and is situated in the inferior wall of lateral sulcus. So you can see the temporal lobe I am highlighting over here, or it is highlighted already in the image in the blue color. So that is the temporal lobe. Area 41 is granular type of the cortex, whereas area 42 is homotypical and is mainly auditory associated. So main function of temporal lobe is auditory or it hearing. Projection fibers to the auditory area arise principally in the medial granulate body and form the auditory radiation of the internal capsule. So mainly it shows how the fibers are projected to from the auditory area to the to the temporal lobe, and it provides the auditory function. A unilateral lesion of the auditory area produces partial deafness in both ears, the greater loss being in the contralateral ear. So, whenever there is a lesion in temporal lobe, as we can find one in the Alzheimer's disease, so deafness we can find in the Alzheimer's disease due to damage in the temporal or degeneration in the temporal lobes. The secondary auditory area. See, there are two parts of temporal lobe: primary auditory area and secondary auditory area. Primary auditory area is Broadman areas 41 and 42. Secondary area is Broadman area 22. It receives impulses from primary auditory area and from the thalamus. The secondary auditory area is though to be necessary for the interpretations of sound of the association of auditory input with other sensory information. So it mainly it has functions of interpretations of sound associated with auditory input. The sensory speech area of Wernicke is localized in the left dominant hemisphere. So if we take the mirror image of the temporal lobe shown here, if we assume this part is right side of the temporal lobe, then the same part of the temporal on the contralateral side, that is left side, so that area left side of the hemisphere is dominated by the sensory speech area of Wernicke. Now, since the Wernicke area represents the site of the cerebral cortex where somatic, visual and auditory associations area all come together, it should be regarded as a very great importance area. See, now somatic, that is sensory, visual, that is vision or eyesight, and auditory, all three area comes to the sensory speech of the Wernicke, this area, which is the left dominant part of the temporal lobe. So now it is very great important because it is also degenerated, and sensory part, visual part and the auditory part is well affected in the Alzheimer's disease. Now we talk about the frontal lobe, the precentral area. See, this is highlighted part is prefrontal. It is the frontal lobe, or you can see in the yellow color, it is the frontal lobe. Now the precentral area is situated in the precentral gyrus and includes the anterior wall of the central sulcus and the posterior part of the superior, middle and inferior frontal gyri. So the anterior part or anterior wall of the central sulcus and the posterior part are both the precentral area is like superior, middle and inferior part of the frontal gyri. It extends over the superomedial border of the hemisphere into the paracentral lobule. So the above mentioned the superomedial border. See, now frontal lobe, the superior part and the medial part both is associated with the paracentral lobe. Giant pyramidal cells of beds are concentrated most highly in the superior part of the precentral gyrus and the paracentral lobule. Now you all must have gone through the pyramidal cells in the physiology or the pyramidal tracts in the physiology part. So the pyramidal cells of beds are associated in the frontal lobe or the paracentral lobule of the frontal lobes. So you can also assume that the functions which are carried out by the pyramidal cells are also affected in the Alzheimer's disease. The greater and the majority of the corticospinal and corticobulbar fibers originate from the small pyramidal cells in the area. The corticospinal and the corticolobular fibers also originate from this area. So it plays a majority of the role in the Alzheimer's when this area becomes or starts to get affected, the frontal lobe, the majority of symptoms are being found. They are involved in controlling the sensory input to the nervous system and are not involved in the muscular movement. Now see, this as the pyramidal tracts are involved, so sensory function is definitely going to involve. Now the precentral area is divided into two regions, anterior region and posterior region. The posterior region is also known as motor area or primary motor area or Brodmann area 4. The Brodmann area, which I am telling from temporal lobe and in frontal lobe, you must have learned in physiology part. It occupies the precentral gyrus extending over the superior border into paracentral lobules. So it is the anatomical representation of the posterior region, and the anterior region is also known as premotor area or secondary motor area or Brodmann area 6 and parts of areas of 8, 44 and 45. Now the functions are shown. The primary motor area, if electricity stimulated, produces isolated movements on the opposite side of the body as well as contraction of muscle groups concerned with the performance of the specific movements. So if you want to perform some specific movement, there are some specific muscles for those specific movements. So if you stimulate those area electrically, you can find those specific movements. Thus the function of primary motor area is to carry out the individual movement of the different parts of the body. So you can also get idea that if the primary motor area is affected, you can also assume that the individual movement of the body parts is also affected. To assist in the function, it receives numerous efferent fibers from the premotor area, the sensory cortex and the thalamus and the cerebellum and the basal ganglia. So it also assists the functions of those all the main parts of the brain. The secondary motor area, when electrical stimulation of the premotor area produces muscular stronger stimulation is necessary to produce the same degree. So if the primary motor area is stimulated, it produces isolated movements, but if secondary motor area is stimulated, it produces some stronger stimulations. It receives numerous input from the sensory cortex, the thalamus and the basal ganglia. So it also receives numerous input from the sensory cortex, thalamus and the basal ganglia. The function of the premotor area is to store programs of motor activity. See, here comes the very important part or the very important function of the sensory motor area, as assembled as the result of past experience. So if you perform a motor task once, then it is stored in the stored in the premotor area of the secondary motor area, or you can say the part of anterior region of the frontal lobe. Thus, it programs the activity of the primary motor area. So, it has direct effect in the primary motor area. It is particularly involved in controlling course of postural movements. See, this is very important thing in this Alzheimer disease. It is one of the clinical feature which is affected through its connections with the basal ganglia. So thus the anatomy portion is covered. Mainly three areas are covered: hippocampus, temporal lobe, and frontal lobe. Now, causes. See, the causes of Alzheimer disease is unknown till now, but there is evidence and study of a genetic predisposition. The patient with Down's syndrome are more likely to develop this pathology as the genetic structure is very much same of both the diseases, and the affected areas of gene is also very much same. It is also assumed that lesion in some neurotransmitter pathways are responsible for this pathology. Now for the clinical features, I would like to hand over to Prachi of our class. Thank you so much.